Hey everyone, this is Callie with the California Perspective, and today we are talking about the life cycle of a typical COVID-19 infection, not including those who have weak immune systems or were severely ill. First, I'd like to give a shout out to Killy Park people and let Sophia know that Jesus and Josue are good friends of mine. Second, if you get vaccinated, it's not a good idea to go back to life as normal yet. Keep wearing your mask and keep social distancing until COVID rates decline and the CDC provides new guidance. But this video is on what to do after a COVID-19 diagnosis. Let's jump into it. Getting COVID-19 sucks. Whether you're adherent to disciplined hand washing, mask wearing, and social distancing, or whether you're an ardent anti-masker. Although if you're an anti-masker, some might say that you kind of deserve it. You may get away with having no symptoms at all, or you may need to be put on a ventilator to get your blood oxygen levels up. No matter who gets COVID, we must all be aware that there exists the potential for others to treat that person as a social pariah. Avoiding those people forever, as though their mere existence provides a new vector for infection. Now, no normal person wants to get COVID. There are those who believe it doesn't exist still, but we'll put them to the side for right now. So it may seem logical for the rest of us to avoid those who had it forever, but the science does not support that type of thinking. I was considering doing a video on the different vaccines. I've heard people have questions about them. Let me know in the comment section below if that's something you're interested in. But for now, that's outside the scope of this video. If you are in close contact with someone who has COVID and are still showing symptoms, you need to quarantine. If you are in close contact with someone who has recovered from COVID, neither party needs to quarantine. Now, at what point does one switch from one to the other? What are the dividing lines in that gray area? According to the CDC, you can be around others after 10 days since symptoms first appeared and 24 hours with no fever without use of fever-reducing medications, and other symptoms of COVID-19 are improving. Note that the loss of taste and smell may persist for weeks or months after recovery and need not delay the end of isolation. There are special rules for those who were severely sick and those who have compromised immune systems, identified as immunocompromised, due to the health condition or medication. People who are severely ill with COVID-19 might need to stay home longer than 10 days and up to 20 days after symptoms first appeared. Persons who are severely immunocompromised may require testing to determine when they can be around others. Make sure to talk to your healthcare provider for more information. If testing is available in your community, it may be recommended by your healthcare provider. Your healthcare provider will let you know if you can resume being around other people based on the results of your testing. Your doctor may work with an infectious disease expert or your local health department to determine whether testing will be necessary before you can be around others. So like most viruses, you tend to show symptoms after your ability to infect people declines. The current research for COVID-19 is summarized by the CDC thusly. Concentrations of SARS-CoV-2 RNA in upper respiratory specimens decline after onset of symptoms. The likelihood of recovering replicant-competent virus also declines after onset of symptoms. For patients with mild to moderate COVID-19 replication-competent virus has not been recovered after 10 days following symptom onset. Well, what does that really mean? Simply put, if you're not severely needing hospitalization level sick, you are not going to be able to spread the virus in a form that is infectious after 10 days of showing symptoms. So those were lab findings. What about real-world results? The CDC found in a large contact tracing study, no contacts at high risk of exposure developed infection if their exposure to a case patient started 6 days or more after the case patient's infection onset. So what does that mean? It means that if the COVID-19 positive person started showing symptoms or tested positive, they were not likely to be able to spread the virus after day 6. This doesn't mean you should go around and start French kissing on day 7, but even being within 6 feet without a mask probably isn't going to spread it. Fun fact, once someone is recovered, they may still have indicators of infection, what the CDC calls persistently positive, for up to 12 weeks. That does not mean that they are infectious. Having the virus and having the virus that is, in the CDC parlance, replication competent, are not the same thing. That is why, after recovery, retesting is unnecessary and informs the patient of, well, typically not a whole lot. The data is not meaningful because whether you are persistently positive or testing negative, your ability to spread the virus is negligible. I have provided a link to the CDC page in the description below to their findings, updated on February 13th, 2021. Check them out. So because this is the real world and things don't always fit neatly into their little boxes, There is one case in their overview of the data that showed one adult with mild illness able to provide replicant competent sample for up to 18 days after symptom onset. So if you're thinking of meeting up with friends in a masked and socially distanced way, and you're the most hyper-paranoid person, if they showed their mild to moderate symptoms more than 18 days ago, they're not going to get you sick. Please note that I am not a doctor, and you should get your medical advice from more than a video on the internet. Look into the data yourself and use knowledge from medical professionals. Reinfection, the same person getting COVID-19 more than once, is a possibility, though it is rare. In most viruses, reinfection is less severe and more quickly overcome by the body's immune system, since it now knows what it's looking for and how to make the antibodies. Though it still needs time to ramp up the antibodies again. Remember that severely ill and immunocompromised persons have special issues to be spoken with their doctors before venturing back into the world. The main point is, if you have friends or loved ones that you would like to see but are scared because they had symptoms a month ago, get over yourself. The virus is not coming after you specifically. Take the proper precautions as you would with anyone. Wear a mask, social distance, avoid crowds, avoid poorly ventilated areas, wash your hands often, cover coughs and sneezes, clean and disinfect surfaces, especially at gas pumps. Those are nasty. I hope this has been helpful for you. If it was, go ahead and give it a thumbs up. If you'd like to help the community, go ahead and hit that subscribe button. For the California Perspective, this is Callie, and I'll see you in the next one. P.S. Wash your reusable masks. If you do not have an N95 mask to wear, using a standard surgical mask with a cloth mask over it is quite effective.